Dear Carmen, dear patients and parents, dear colleagues and friends, thanks a lot for the kind opportunity to introduce you to our novel pediatric network for medical care and research on COVID-19 sequelae, similar post-acute infection and vaccination syndromes, and ME/CFS. The we in PAVIS is introduced here to include post-vac. Our network is being coordinated at our Munich Chronic Fatigue Center for Young People and integrates more than 90 clinicians and research partners. I myself am a pediatric hemato-oncologist with original research focus on EBV-associated diseases. I have no relevant conflicts of interest, being involved in committee work on long COVID and ME/CFS and receiving state and private funding for research projects on this topic. We still do not know the prevalence of ME/CFS in children and adolescents. Based on pre-pandemic population-based data from the UK and America and Germany, the Institute for Quality and Efficiency in Healthcare estimated up to 90,000 of our 9 million school-aged young people to be affected by ME/CFS. This pre-pandemic number might be too high for several reasons. However, during the pandemic, the number of ME/CFS cases increased due to severe forms of long COVID, as depicted here in the SOS posts of patients. Remarkably, the German government recognized this problem and consented with many of us that a significant number of children and adolescents is affected by long COVID and long COVID-like diseases, and that these kids carry a high risk due to age-specific vulnerabilities and special psychosocial needs. That health issues of kids in general significantly impact on the well-being of the society, and that we are currently facing a significant lack of specialized healthcare and research infrastructure. Subsequently, the Joint Federal Committee, GBA, implemented an official guideline to stepwise specialized medical care of long COVID and diseases with similar causes or symptoms at any age. And funding was announced for projects addressing care and research on these diseases, with a special funding measure for adults, for adolescents and children. This is important since precise phenotyping during patient care is depending on appropriate budget and essential for such successful research. 4 model measures for the care of children and adolescents with long COVID and diseases with a similar cause or manifestation have been granted with supply of 45 million euro. NGK for Family is led by a parent organization and addresses the resilience of families with severely ill children through self-help. PEDNET-LC is headed by the Charité and builds upon a myocarditis registry to investigate cardiac post-vac. CFS data will analyze secondary data from healthcare insurances linked with survey data to early predict and follow up cases with long COVID. And finally, PEDNET is our large clinical and research network, which explicitly addresses not only long COVID, but also similar post-infection and vaccination syndromes, as well as any type of ME/CFS, summarized here as long COVID-like diseases, LC. PEDNET will make use, evaluate, and further develop knowledge, experience, and infrastructure to establish sustainable state-of-the-art care and research for long COVID in adolescents and children. we are building up 20 interdisciplinary comprehensive care centers for long COVID, 2 pediatric pain clinics, 3 pediatric rehabilitation clinics, and 8 research institutes with expertise in medical informatics or health services research. And moreover, we cooperate with health insurances, with the dedicated professional associations and patient organizations, as well as ME/CFS foundations. Our focus is not on patients who largely know where to go, such as patients with post-intensive care syndrome, PICS on the left, or patients with exacerbation of pre-existing diseases, or with symptoms suggesting well-known diagnosis in the middle. We are focusing on young people with complex symptoms not explained by other known medical conditions, which have caused a participation deficit and/or post-exertional malaise, or even the full spectrum of ME/CFS. 10 work packages are addressed. Our multidisciplinary, multi-professional steering committee will care for sustainable national and international networks, public relations, a national map, and specialized healthcare services to come together, and others. We will explicitly strengthen participation in all parts of the project by a separate project focusing exclusively on the involvement of patient, parent, and public PPPI. In a national virtual CCC, we will perform evidence research, knowledge translation, e.g. into SOPs, guidelines, and education programs, and provide an expert board for the most difficult cases. Federal CCCs are being implemented in each federal state to offer specialized diagnostics and therapy as tertiary care centers, train social pediatric centers, explore telemedicine, palliative and follow-up care, and offer regular expert boards. A distinct school project will provide specific health education to schools, explore school screening, and collect alternative school offers. Project 6 aims to improve our intra- and cross-sectional communication infrastructure, while Projects 7 and 8 are building up common research infrastructures to pave the way for multi-center clinical and translational studies, as well as health services research. Project 9 evaluates the perspectives of medical staff in the CCCs and beyond, and Project 10 focuses on health economics, using secondary routine data from health insurances linked to primary routine data from our multi-center registry. Patients will be guided to the PEDNET CCCs by our website or their local doctors, and get email contact with the responsible federal CCC depending on their zip code. The CCCs will then send digital clinical report forms in REDCap format to A, screen to decide about admission, and B, prepare needs-based diagnostics before admission. All REDCap data will be imported in our multi-center registry and used for medical care as well as for research. Our PAVIS ME/CFS registry supports the collection of standardized, harmonized routine data, integrates patient-reported data from REDCap CRF, as just said, collects multiple data from medical visits, and includes data from patients with all types of LC or patients with similar symptoms but differential diagnosis to support biomarker research. A central biobank is set up in Dresden and Freiburg and is tightly linked to the registry to support translational studies. This novel ME/CFS registry was fused from 2 state-funded multi-center mother registries, which separately addressed ME/CFS or long COVID, and they together had supported the first publications on children and adolescents with ME/CFS in Germany. Here you see the multidisciplinary, multi-professional group of PEDNET PIs and partners at our kickoff meeting just a week ago in Berlin. And I thank all these people for their contributions, including the pediatric and psychiatric and research PIs, as well as the cooperation partners and all members of our international and scientific advisory board. And I thank you for your kind attention.
And then we have time for a few questions. Absolutely, you have kept your time. I have some from the net for you.
Hi, will this just be a German initiative or an EU initiative or an international, fully international initiative?
Well, this is funded by the German government and is a German initiative. But of course, we will build up a network with everybody else to proceed.
Other questions from the audience? Raise your hand so we can see where you're. Okay, then no. Okay, then I have one from the online streaming. How can patients help the research into long COVID and ME/CFS?
How can patients help us? I think if they think together with us about how to do this best, we had a lot of rounds discussing with patients how to about the concept, about single work packages, and I very appreciate that. And it's a focus of the PPPI project.
Okay, great. Other questions from the audience? If not, then we are going further on with Katrin Hoffmann. I would like her to come up and applause for you. Thank you.